Professor Bismuth. It is a deeply honor for me to be here delivering this lecture in the heart of the Compagnons, and Genève represents for me a lot because I became Compagnon in 2009 here. So it is very important for me. I'm going to read a part of this lecture because it's a philosophical lecture, and any word means a lot, and I don't want to be misunderstood. So this is the last photo we took 2 days ago, and you will see the photo from in Genève in the same place in 2009, and you will compare that we have some missing companion. So most professional, indeed most human beings, aspire to achieve excellence, motivated by the desire to best serve others and to stimulated by internal or external competition force. Most of us seek to perfect what we do and enjoy the reward of being recognized as the best in our field. Consequently, rating someone in a particular field is part of our culture. The bar is set to a certain level, and whoever exceeds this point and maintains that level of performance is considered to be the best. Most young men and women who choose surgery aspire to be the best in their field. Yet, unlike other areas of performance, rating surgeon is a more complex task. The question of how good a specific surgeon is has always been interest to the patient who seek their care, to those chair of surgery who hire surgeons, to the administration of hospital where surgeons practice, and to the society at large. This talk will address the elements that facilitate the development of excellence in surgery, as well as the characteristics that surgeons, particularly those who are in the early stage of their career, might emulate to become truly great surgeons. You are going to read and hear the word "the best surgeon" many times during my talk, and what I simply want to represent excellence in surgery with the best surgeon. It is important to assign technical skill its true place, for though it is a sine qua non non-asset of the best surgeon, technical skill should be accompanied by other attributes such as knowledge, poise, and common sense. These virtues separate a good technician from the best surgeon. Surgeons often equate excellence with the mastery of surgical technique, which can lead to the erroneous conclusion that the best surgeon is the most skillful one. Moreover, it is not uncommon to hear unpleasant comments regarding colleagues who are slower and who have less developed technical abilities. To balance these conditions, good surgical residents emphasize the development of technical abilities as well as decision-making skills in surgery. The ultimate goal of an operation is to benefit the patient, not the surgeon. Although skillful surgeons possess a rare ability that, if used well, can yield enormous benefit to the patient, being the best surgeon also involves walking away from the narcissist concept implied "I have done what others could not," and focusing on whether what we have done benefits the patient and not simply what can be done. The best surgeons are not the ones who fight cancer regardless of the consequence brought about this fight and who justify their decision as necessary to eradicate a disease. We should bear in mind something Henry said when talking about irresponsible surgeons. I have never seen a surgeon dying in the operating room as a result of his reckless performance, but I have seen patients die or feeling pain or undergo complication because of this imprudent surgeon. The speed with which a procedure is performed has been erroneously used as a proxy for excellence. We have witnessed on occasion a trainee trying to impress the attending physician with quick and elegant maneuvers. Unfortunately, we have also senior surgeons display this behavior. Time should not be driver, perfection should be. An excellent surgeon ego should not be bruised when there is a need to stop, move back, and rethink when the patient's best interests are to take. For outside the observer, what the best surgeon do looks easy. Operations are carried out with simple maneuvers, even when a case is complex and difficult to resolve. And when such observers have the chance to treat similar cases, they may comment, "It seems so easy when he did it." Teamwork requires great communication skills, establish a shared mental model, explain everything that will be done, when and how, and maintaining the spirit of the team through the operation. The best surgeon lead the surgical procedure and support all the members of the surgical team. In this collaboration setting, team members feel protected, I'm in distress, and empowered to speak and to contribute. Crises tend to develop rapidly during the course of operation. Maintaining a calm behavior, avoiding loud voices, and eschewing criticism of any member of the team at the time of a crisis is essential to managing it successfully. It is at this time that the best surgeons have the opportunity to shine. Some surgeons do not develop joy or pleasure from operating or from interacting with their patients. Good surgeons feel lucky to be able to link work with pleasure and passion. And passion for a profession is like falling in love. You either feel it or you don't, and it does not necessarily reflect negatively on the physician. Surgery is not a job that must be done to survive. It is a choice. Experiencing fear before a complex procedure is a normal and helpful feeling. Fear keeps you focused and alert. Only the reckless feel not fear. Thus, good surgeons realize that fear is part of surgeon's life. The best surgeons are the ones who achieve the best immediately and long-term results. Only the deep and objective analysis of such results will give them the information necessary to reach excellence. Complications worry the best surgeon, but do not become an obsession. They try to sort them out, learn from them, and avoid future ones. The best surgeons do not feel weakness asking for help. Rather, they feel strengthened knowing that the patient will experience the best possible outcome. People who have nothing to learn from others have nothing to teach. The best surgeon establish trusting relationship with their patient and their patient families. This responsibility cannot be delegated. Patients and people with needs that extend beyond the mere treatment of physician illness. They feel the pain of their patient and the concern of their relative as if their own. Once surgeons have lived a life in surgery and reached a certain age, it can be difficult to humbly accept retirement. The best surgeons know when to leave the operation room for good. It is always better to do so 1 year too early than 1 year too late. It is better to be asked why rather than when. The pain surgeons feel for their patient is inescapable, and it comes with a price that some surgeons unload on their own families. The best surgeon master the art of letting go of work to spend quality time with their family. Maintaining a healthy relationship with one family is crucial. The best surgeon finds ways to balance these two important aspects of life. Mentors guide us through a career path. They provide sage advice, personal counseling, and support our growth. Mentors go beyond teaching. They impart wisdom. A mentor not only inspires us, but also influences our life on many levels. This deep influence is the reason why most surgeons who achieve excellence have at least one mentor, and usually more than one. Some mentors excel in the technical details and inspire us to exercise skills, precision, and simplicity in the performance of an operation. Other mentors exhibit keen interpersonal skills. These physicians encourage mentees to develop the communication skill that allow us to establish productive relationships with our parents, colleagues, and teams. Historically, the name mentor is believed to take its origin from Homer's The Odyssey. When the Greek king Odysseus left for the Trojan War, he asked his friend mentor to raise his son Telemachus into adulthood. The word mentor is currently defined in the Oxford English Dictionary as a person who offers support and guidance to another. Nowadays, the term mentoring encompasses an entire spectrum of learning and supporting behavior, which allow one individual to help another to develop and grow. Achieving excellence, becoming the best, is almost always associated with outstanding mentorship. The relation between a senior surgeon, the mentor, and his or her protégé, mentee, is like no other. Thus, mentors are acknowledged more in surgery than perhaps any other medical discipline. Surgical training in the 21st century, as has been shown previously, is undergoing many changes, which clearly alter the available time and opportunity to the mentor. These changes mandate new approach to mentoring. For example, most of today's mentees will benefit from multiple mentors in a variety of areas, including personal life, technical skills, research, clinical aptitude, and administrative duties. The advance in the surgical simulation laboratory and the information technology expand the ability of the mentee to learn more safely and expeditiously when compared to previous areas, as you have demonstrated here. On the other hand, distinguished quality of humanism, altruism, and empathy of surgical mentors of the past are shared as relevant today as when the senior mentor was a mentee. We are concerned these qualities are regrettably becoming lost in today's frenetic world of surgery, and there is a need to integrate the old with the new modalities. The need for multiple mentors is rapidly becoming dominant in today's world of limited time for teaching. Multiple mentors include individuals with special expertise, research, clinical, care, administrative, etc., who due to time constraint limit their interaction with the mentee to well-defined areas. This approach is the antithesis of the classical one-on-one mentor-mentee relationship. There is a strong precedent for mentoring at the highest level of academic excellence, as is exemplified by more than 50% of US Nobel laureates having served under other Nobel laureates in the capacity of student, postdoctoral fellow, or junior collaborators. Doors of opportunity are open as the result of the acknowledgement, prestige, stature, peer recognition, and accomplishment of the mentor. When referring to a young sergeant who has recently completed training, how often do we hear the compliment, "He trained under the famous Sergeant Professor X"? Whether or not completely justified, comments and associations such as these frequently provide an aura of instant credibility to the mentee. While one can dispute the appropriateness of this evaluation, association with influential mentor continue to be vital in the 21st century to advance careers as young surgeons. Multiple forces catalyze change in the traditional model of surgical mentor, and I found these words from Isaac Newton that meant a lot. So future directions are these multiple forces catalyze changes in the traditional medical surgical mentoring. Surgical mentoring will occur during simulation sessions. Telemonitoring will be used for surgical mentoring over long distance. Mentees will have multiple mentors, each with a specific role. An assessment of technical skill will become more objective, allowing for competency-based training. I am very proud to have become a compagnon in 2009, and I became compagnon because I received the knowledge from Professor Bismuth through Miguel Sardulo and Oscar Andriani that work many times with me, so I aspirate all this knowledge in order to have the opportunity to belong to this prestigious group. Thank you very much.
Thank you. Thank you a lot, Eduardo. I like your lecture. Indeed, you know, it is so difficult to be a good surgeon, to be a surgeon. And this can explain why in some countries now, few young people want to be surgeon. And this is, it could be this. We have to learn skill, to learn how to deal with the patient, to learn compassion, to have also the desire and the love to work with others. Really, it's very difficult. Question? Yes, please come.
First of all, thank you very much for an excellent presentation and an excellent paper. I think it's the only scientific paper that gave me goosebumps when I was reading it as a young surgeon, so thanks a lot. All professional athletes have coaches. I mean, we're in Switzerland. Federer had the same coach for 10 years, even if he's at the top of his level. Do you think mentorship should extend beyond kind of the top to bottom trainee model, and even established surgeon should still have a coach rather than a mentor? It can still be called a mentor to guide them. A lot of people now in the corporate industry would always have a coach. Even sometimes they're trained psychologists that give them advice about how to perform and how to deliver. Do you think we should somehow involve that in our trained surgeon as well as our trainees?
In my opinion, this relationship is essential to grow, and it will avoid you a lot of problems, and you will be guided. Sometimes when you are lost, your mentor will guide you through the correct place. So I can feel very easy the difference of a trainee when he has and when he has not a mentor. The guys who has mentors, and it has been demonstrated in a lot of papers. I don't want to bore you with this data, but there are many data already written in the benefit of the mentorship. So I think it's essential, and you have you not have to wait that the mentor came to you and say, okay, I want you to be my mentee. No, you have to detect the person, look at his eyes, know if there is some connection, and then be aggressive with him in order to try to attract him, because this is going to be a huge advantage for your career life.
Eduardo, merci. Excellent talk. And I don't know if you were aware, but there were a few talks about training, a lot of technical, a lot of standardization, a lot of simulation, pilot and everything. But I think you straight to the point, really most important for me, it's mentorship. And the mentor is not a coach. Coach, you'll do it in the simulation training, but mentorship inspires you. You go beyond the limit and you have a philosophic link with him. And it is true that, in my opinion, that is surgery, and you have to integrate both. So, gracias. Merci.
Gracias.
No other question.
So I have some words, last words. Chenib mentee also to me because Juan Pecol, one of my mentees, the first mentees, become associate compagnon. And I had to say that when I was preparing the talk, I inspired myself in Tom Starzl and Henry Bismuth. Thank you.
Thank you.